is a plate which is thick, whereas the 1/3 tubular plate is quite thin. The 1/3 tubular plate also can be bent easily by hand, whereas it is a little more difficult to bend the plate. The next plate, which is similar to a 1/3 tubular plate, is this. This is called the recon plate or the reconstruction plate. The reconstruction plate is used when there are a large number of fragments and you want to hold them in a peculiar manner. It is also used specifically when the fractured fragments are not in a straight line and cannot be fixed by a 1/3 tubular plate or a DCP. This is a plate that can very easily be bent into whichever shape you require, and it can be molded to fit the surface. A common use for 1/3 tubular plate is fractures of the pelvis, where you have large irregular surfaces and small pieces. They are kept together by this method, and compression cannot be given using a 1/3 tubular plate. If you see a plate which looks like any of these, but on the end has got a broad surface, this is called a buttress plate. There are different types of buttress plate, small and large, but they are all buttress plates. Buttress plates are also called T plates because they have the shape of a T. Why should you use a buttress plate? A buttress plate is used in a peculiar condition. A normal fracture, that is a usual fracture, is at the shaft. It fractures like this, and therefore you put the plate onto the surface. However, if you have a fracture of this condyle only, then a fixation is different. The force between these two is most probably a separation at this angle, and a force between this fragment and this main fragment is maybe a separation at this angle. In this condition, you can use the 1/3 tubular plate. Suppose this is a fragment and this is the main fragment. You have to, the buttress plate. You keep the buttress plate like so and fix the screws here, and this part of the buttress plate presses the condyle onto the rest of the bone, and this is the way a buttress plate or a T plate can be applied. A cobra plate is also a plate which is similar to this. This is classically used for a tibial plateau fracture or a tibial condyle fracture, that is for the upper condyle of the tibia. The same mechanism is there for a Barton's fracture of the radial head, and it is fixed by a plate which is very similar in shape. This plate is also a T plate, and some people call it the Lis-T plate. It is fixed primarily using this hole through which you pass a screw, and before that it has to be molded in to fix that silhouette of the radius. Once this is fixed using this screw, the plate can be slid to the front so that it gives the adequate compression, and the peculiarity of this plate is it gives compression by its shape, and the 3 holes that are here need not be filled with the screws, and a T plate or a buttress plate can be fixed without screws on the top if you want it to be like that. Suppose you want to compare and contrast the nails for the lower limb. The K nail is the easiest to identify because of its clover leaf shape and the 2 eyelets at either end. The interlocking nails are also very specific because they have got a tubular shape and the locking holes. But there is another nail called the V nail, which is popular in some centers and not unpopular in some. The V nail is used to fix the tibia. How to differentiate a tibial nail from a femoral nail? The femoral nail is always relatively straight or may have a slow bend. However, a tibial nail will have a straight main shaft and a sudden bend. This sudden bend, which is seen in these three nails, make us to differentiate between these nails which are tibial and these nails which are femoral. The femoral nails which are shown here are a K nail which has no bend and bends along this line when it is stressed because of its inherent elasticity. This interlocking nail has got a slow and gradual bend, which you can see if you look carefully. However, these are the tibial nails, and these tibial nails have got a specific purpose. This is the V nail. If you look at it carefully, you can see that the cross section of this nail is a V. And the same purpose is served by the tibial interlocking nails like so, which have got a circular cross section. The one thing that you should never forget is that if a nail has got a Herzog bend, it is being used for the tibia. In certain conditions, there are places where people use a K nail for the tibia by making a Herzog bend, which is popular procedure in some centers. However, the tibial nail is most specifically a V nail or a tibial interlocking nail. These are the half rings of the Ilizarov apparatus. These two half rings, when combined together by the necessary nuts and bolts, are then combined with the Ilizarov threaded rod, which is again adjustable because it has got thread from top to bottom. You can put a nut wherever you want. Finally, give rise to the completed Ilizarov apparatus. Now, the Ilizarov apparatus is basically used for distraction, limb lengthening. Till the invention of this apparatus by Gavril Abramovich Ilizarov in Kurgan, which is in Siberia in Russia, bone was a non-expendable organ. The only way to get new bone to a certain area was to graft bone from another site. But Ilizarov, with his magic pins and rings, demonstrated that bone can be formed de novo just by distracting the bone. The Ilizarov apparatus is so versatile that it can be used for almost anything. The only problem is it feels ungainly to the patient because there is a large amount of hardware around his body. It is fixed to the bone in question with small Ilizarov wires, which are then tightened by the nuts in question. The distal fragment is connected to one Ilizarov apparatus, and a further extension of this apparatus is then connected to the proximal fragment. Once these two apparatus are assembled to form a fully formed Ilizarov apparatus, whichever procedure you want in this bone can be done. If you want to just hold it stable, just connect the top apparatus to the bottom using ordinary threaded rods. If you want distraction, you distract the threaded rods and the bone will slowly distract and new bone will come in between. If you want to correct an angular deformity or you want to produce an angulation, you connect a hinge between the top and the bottom part, and you can slowly make it angulate whichever way you want. And the same goes for rotation. For a person who is well versed in Ilizarov, all these angulation, rotation, lengthening can all take part in one single step if you are versatile enough. The Ilizarov has now been replaced by many types of limb lengthening apparatus like Wagner and Orthofix. However, whenever there is one condition, the only thing that can help the patient is Ilizarov, and that condition is infected gap non-union, because when there is distraction, the infection will subside, and when there is distraction, the gap will close. All these things can be given together in a single step by Ilizarov apparatus. So, the most important and permanent indication for Ilizarov is infected gap non-union. There are, however, an Indian methods to give distraction to the patient. It is this. This is Joshi's external stabilization system distractor, also called JES distractor.